Hello everyone, we'll discuss here croup or acute laryngitis. For the latest updates on pulmonology, refer to the Pediatric Board Study Guide 3rd edition. Croup, very important, very high yield. Croup is acute laryngitis, which is inflammation of the larynx. The most common cause is parainfluenza viral infection. However, other viruses can do that. For example, influenza A and B can do or can cause croup, but the child will be having higher fever, looking more sick or ill. This virus infection will cause subglottic narrowing or inflammation in this area and difficulty breathing. This is common in young children between 3 months and 3 years of age. Spasmodic croup is similar but without viral infection or any prodrome, just comes all of a sudden and no identifiable cause. Clinical presentation of croup, URI, for example, congestion, runny nose, with or without low-grade fever, can be associated with high fever, especially with influenza A and B, COVID-19. Barking cough will give you the classic barking cough. Once you hear it, you make your diagnosis. Or brassy cough. Inspiratory stridor. In more significant cases, you will hear the stridor, either inspiratory or biphasic. In more severe cases, you will start to see retractions, suprasternal retractions, hypoxia. This is very bad and has to be admitted right away, and respiratory distress. The child might prefer to sit or be held upright. Croup is a clinical diagnosis. You hear the barking cough, you make your diagnosis. No need to order a chest x-ray. A steeple sign seen in cases of croup can be seen or can be absent in case of croup. Also can be seen as a normal variant in normal person without croup. Classification of croup is very critical to know. Mild cases of croup, this is the most common, occasional barking cough, no audible stridor at rest, no or mild suprasternal retractions. Moderate cases, frequent barking cough, easily audible stridor at rest, suprasternal retractions with no or minimal agitations. Severe cases of croup, persistent and prominent inspiratory stridor, severe suprasternal retractions, significant agitation and distress. This is a late presentation of croup and impending respiratory failure. Don't miss that. The barking cough will be often not prominent. The child is already tired. Audible stridor at rest, you will hear that. Less suprasternal retraction, the child is tired to breathe. So this is impending respiratory failure. Lethargy, looks like going for a shock. Dusky appearance and cyanosis. Hypoxia. Any child with croup having low oxygen has to be admitted immediately. Management of croup, mild cases of croup, you can reassure the parents it will resolve, but it will take time. And observation at home with adequate hydration, bedside humidifier, control the fever if there is any with ibuprofen or Tylenol. Dexamethasone is very helpful in cases of croup to prevent worsening of the case by giving 0.6 milligram per kilo one-time dose oral. If the child cannot tolerate the oral, you can do intramuscular. This will decrease the laryngeal edema and the need for hospitalization. Oxygen supplementation and racemic epinephrine in moderate to severe cases. Racemic epi doesn't cause rebound obstruction, so it is very safe to use in cases of croup. Racemic epinephrine also should be used cautiously in patients with underlying heart condition such as left ventricular outlet obstruction. In pediatric ICU, you might supplement with oxygen, especially helium oxygen or heliox. This may be effective in children with severe croup. Admit for severe distress, hypoxia, inability to feed or drink, requiring 2 or more nebulized racemic epinephrine without improvement. Consult pediatric pulmonology ENT if prolonged course or multiple days in the hospital. Endotracheal intubation should not be delayed until the patient becomes restless and cyanotic. You have to use a smaller size endotracheal tube in cases of croup, like 0.5 to 1 millimeter smaller in size. Intubation is more likely you will see with bacterial tracheitis, epiglottitis, but rare in classic cases of croup. If intubation is required in a case of croup, think about measles as a cause or influenza A. This is the end. Thank you.
Having trouble or trying to pass the pediatric board exam? We have the definitive solution for you. presenting the Last Minute Review series, a powerful tool for achieving success in pediatric board exams, crafted by Dr. Osama Naga, a board-certified pediatrician by American Board of Pediatrics and the editor of the Pediatric Board Study Guide, a last-minute review. Dr. Naga breaks down the most critical subjects in this series. The Pediatric Last Minute Review webpage offers a thorough and rigorous set of pediatric board review sessions that are in line with the study guide. The lectures will cover the most important topics for each condition that a pediatrician must know for pediatric board exams, as well as real-life clinical encounters. The inclusion of a clinical case scenario, accompanied by multiple-choice questions, followed by the most probable answer and a comprehensive description of the issue, will ensure test readiness for each student. You will be able to download the lecture's PDF files to make your studies easier, to take notes and be accessible on the go and offline. Based on the membership plan you choose, you will have unlimited access to the lectures for either 1 month, 3 months, 6 months, or 1 year. By viewing these videos, you will increase your chances of passing the board exam and gain substantial advantages from the acquired knowledge. Additionally, by studying the material and completing the AAP prep questions from the previous 3 years, you will greatly increase your likelihood of passing the board and will acquire a wealth of knowledge. Click on the link provided below to visit lastminutepediatric.com and subscribe immediately. Be sure to take advantage of our free video samples on our YouTube channel, Pediatric Board Last Minute Review. Good luck with your exams.